and the kneecap in there. And then we're going to look at patellofemoral pain, which is, again, quite common in adolescents. I find it a bit more in females, just due to like biomechanics, but that's when they'll get that kneecappy kind of pain. So I'll show you those two. And then we're just going to do a little additional bit of like a fat pad deloading. So sometimes if these things aren't working, we have a little fat pad shock absorber in our knee that might be a bit inflamed and sore. We can offload that and it might make their jumping and like landing feel a bit more comfortable. So it's just something to have in your back pocket because it's not going to make them feel worse, but you could always try and see if it makes them feel better on the field or on the court. So knee donation. Does anyone have a knee they want to do for this one? You got some knee? Beauty. All right. Would one of you guys be able to give me one of the skinny rolls of the like thumb tapey kind of stuff? Yeah, thank you. All right. Radio. Let's do patellar tendon first. So I'll get you to come around this way in front of everyone. Thank you so much. Alrighty. You're right? Yeah. Don't worry about it. Okay. So we'll start with the patellar tendon taping. This is like the easiest tape you could possibly do. So I'll get my player facing towards me. Now, what was your name? Sophie. So Sophie's got a sore knee down here. When you feel your kneecap, you've got that bony bit there. You've got the bottom of your kneecap there. In the middle, there's like a squishy zone. And that's what we want to tape over is this squishy zone here. Okay, so that's the patellar tendon and we want to deload that. So all we're going to do, you can get a little bend in the knee. I find it's easy to find the squishy zone if they've got a little bend in the knee. Tape goes in that spot. Oh, where are you going? There you are. Now, we're just going to do a few loops around the knee. That's all it is. I just wouldn't go over the knee joint line, like where their crease is. So generally you can go above or under, whatever you feel like. It just means that also they can jump more comfortably and not feel restricted or their skin pinching at the back of the knee. So you want to have a little bit of pressure going around there 3 times. And then all you do is cut it off. Sorry, Aunt, I'm going to steal the scissors off you. Oh, sorry. That's all right. I was letting you cut tape off. All right. So that is your patellar tendon taping. You can put a little bit of rigid just to lock that down because that's another one that will just flail in the wind a bit if it gets wet and or sweaty. It's sometimes a tough one to stick on if it is sweaty. So if we can try and lock it down, it should hopefully get them through a game. So that's that. Any questions on that one? Pretty straightforward. Yeah, cool. Alrighty, I'm going to get you to have a seat on the bed for the next one. Everyone hustle in. I'm going to get you to scooch back so you've got straight legs. Excellent. You happy sitting like that? Yeah. Is that your phone? Yeah. Okay. Alrighty. For the next ones, I'm going to use a combination of Fix-Mol underneath, the rigid, and then the stretchy blood tape. Can I grab that one there? Thank you. Perfect. And this is just to lock it off again like we did with our last knee tape. So let's look at the patellofemoral pain taping there. So as you can see on the picture, it looks like almost just a strap over the kneecap. So what we're going to start with the Fix-Mol, I would cut about 2 pieces that would cover the kneecap and go around the side there. And the good thing is you can kind of do this in one cut. So figure what you want. We want 2 bits of it. Do it like that. So then you know they're going to be the same length and they're not going to look uneven. And then cut through there. Alrighty. So what we're going to do is almost imagine part of it's going to cover the top half of Sophie's kneecap and then the bottom bit's going to cover the bottom half of Sophie's kneecap, okay? This, again, has no tension. It's like the anchors for everything else we've done. We're just sticking it on. We're going to add the tension when we put the brown rigid tape on. So just laying it over there. You'll get a small little overlap. Dun, dun, dun. Like this. Like that, okay. So this is what our base layer looks like, okay? So just stick it on, no tension. Then we get our brown tape. So with this tape here, there can be a few variations. So when your players will come to you, they might say, I like to be pulled in or pulled out, okay? If they don't, I generally just pull it in, but they might say pull it out. So what we're going to do here is probably get a bit of tape, what's that, about 10 centimeters long? Rip it off there. We're going to stick it on the outside of the knee. Now I will hold it down with my thumb, push Sophie's kneecap to the middle, and then stick it down. Now you get this little smiley face pucker with the skin in the white, and that's exactly what you want. So if there's no pucker or smiley face, the tape's not doing anything. So I tend to do 3 layers of this, so same as what we did with the white. Tape down there, hold down, pull across. Again, do you feel like you're kind of getting a bit squashed in the middle of your knee? Yeah. And then just for good measure, I'll actually do a 3rd one across, but again, there's no golden rule in terms of how many pieces to put on, like that. So there. So as you can see, if you come in close, you can see that there's these little dimples around Soph's knee, more so on the side that you're pulling towards. All right. So this is also called the McConnell's tape, if like anyone's heard of any taping names. If you have a player who's seen a physio, they might come to you and say, oh, I need the McConnell's tape done. And this is what they're on about. Alrighty. So on top of this, we're going to do the fat pad taping. So it's just a little addition. You'd have this as your base. And then what we're going to do is add a V to essentially imagine lifting like the kneecap up a little bit there. So you can put your fix-a-mole down underneath, or you can go straight into just putting the rigid down. What I like to do is just pop a little start point for it. So I might do with the fix-a-mole, just cut off a bit of a random length like this and stick it on that bony bit on the front of the shin again, okay? Like that. Again, doesn't have to be pretty. We're not really going to look at it. So starting from the bony point in your knee, you're going to do a nice 45-degree angle up to where the side of the McConnell's tape finishes, and you're going to pull up. So I'd measure my tape. I know I want it to be about that long. Holding down there and pulling up. Does that feel like it's pulling your kneecap up a bit? Yeah. So we're going to do that 2 layers on both sides, okay? Same thing, stick down, pull up. And you start to get this like really smushy part in your knee, kind of a nana knee thing. But that's also how you know you're doing it right. So it should be smushy there. That, pull up, like that. Where are we? The same thing, pulling up and out there. Okie dokes. Everyone see how that V kind of sits? Then we just want to make sure it sticks down. So if you leave it like this, as soon as your player gets up and bends their knee, it's just going to pop off. So a couple ways you can do it. If you don't have access to this kind of stuff, you can just do a layer of rigid there around the bottom of the knee like we did the anchor before. Same thing around the top and hold it down. I typically like to layer up with this stuff as well, so it's not as much rigid tape kind of locking them in. They still feel like they have a bit of movement, can bend their knee, that kind of stuff. So I'll show you how to do that. I'll just get this stuff out of the way. And again, it's just following the line of the tape. So go there, I'd get Soph to lift up her leg, awesome stuff, and then follow the line down there, under there, up and around, up there, and just stop it. Okay, so again, we're just covering the top and bottom and crosses of the brown tape. Rip it, and then just lock it off there. And then always make sure that your player can bend their knee. So then if you need to change anything, you can easily unpeel that last layer and make little adjustments. You don't have to start from scratch. Feel good? Yeah. All right. Everyone happy to have a go at that? So we'll go through all 3, grab some of the skinny tape for the patella tendon, and we'll go from there. Yes.